chronic pain affects more than 50 million Americans,
which is about 20% of our population.
It can look different for everyone.
Arthritis and fibromyalgia, complex regional pain syndrome, traumatic injuries.
The symptoms can detract from someone's quality of life.
Fatigue and poor sleep, restricted movement, tense muscles, shallow breathing.
Sharon Krispinsky coordinates Lee Health's Chronic Pain Workshop. The free class meets once a week for 6 weeks and teaches a variety of tools to help people deal with chronic pain.
Now, medication is one tool, but there are others such as healthy eating, the importance of physical activity, mindfulness.
Having a positive mindset is also huge. Krispinsky says those dealing with chronic pain have a choice to be an active or passive manager of their condition.
And active managers means that, you're engaged, you're seeking out information, you're still, doing your activities of daily living. Where a passive manager, and we all know passive managers, those are individuals that tend to isolate, they don't seek out information, and they're not engaged in their activities of daily living.
Krispinsky says more than 60% of participants report decreased pain afterwards. You can sign up for the free workshop by searching for chronic pain on leehealth.org. For Lee Health, I'm Devin Turk.